So at the moment, there's a lot of debate online about contraception and hormonal contraception in particular. It has
Yeah.
obviously been instrumental in women's liberation, but we're still putting up with a lot of nasty side effects, and a lot of us just don't really know what's going on in the contraception
Yeah.
world, what we should be on, what's right, what's wrong. So, our first question, and we actually asked our audience for questions, so some of these are picked from the audience,
Yeah.
is do we have a menstrual cycle when we're on hormonal contraception?
Yeah, great question. And I think it's kind of one that probably isn't well explained and something that people don't know as well. So it definitely changes your cycle when you're on hormonal contraception. So it really depends on what you're taking and how that affects your cycle. So definitely you don't have a menstrual cycle in the traditional sense, especially because ovulation can be affected. It may be suppressed and not happen at all. And you will have changes into your hormonal fluctuations as well. So it depends on what you're taking. So if you're taking the combined pill, for example, or combined hormonal contraceptives, you've got estrogen and progesterone. So thinking of things like the ring, the patch, combined pill, because they typically work by suppressing ovulation, it means that you don't have that typical menstrual cycle, so that typical rise and fall of your hormones. Um, because of the fact that we don't want ovulation to be triggered in the same way, we don't want an egg to be released. And that's really how it works to help prevent you becoming pregnant if you're taking it. You still do get the bleeding, the withdrawal bleeding towards the end of your period of taking the pills, for example. So sometimes people can think that's the period, but it's actually a withdrawal bleed. So it's just because of hormonal changes that you experience that bleed. So it can kind of feel though like it is your
Mm,
period, and I think a lot of people feel, I guess it kind of helps them feel like they still have that cycle having that withdrawal bleed, especially if you're on the combined pill, for example. So yeah, there's definitely kind of similarities there. And what's also interesting is that some people, even though they're on hormonal contraceptive and they don't have the typical cycle, they still do get changes in their cycle that you would expect with a normal cycle of someone who's
mm.
not on hormonal contraceptive. So, you still may get that kind of premenstrual, pre-period type symptoms of like low energy, bloating, fatigue. And then you also may have times where you're feeling more energetic mid-cycle and that sort of thing. So it's definitely really interesting, and it's still worth kind of tracking and seeing what's going on for you. I suppose if you're taking something that's progestin only, so just containing a synthetic progesterone, it can be a bit different. You may have kind of more irregular bleeding patterns throughout the cycle. You may have no bleeding at all. And I suppose if you're on longer acting options like hormonal IUDs and that sort of thing, you may have no bleeding at all. So you may have, in some ways, some people feel like they've got less of a cycle because they're not kind of taking the pill every day. But yeah, it's very, very individualized and varies depending on the person.
Super interesting. We actually had a debate with
Yeah.
some female friends recently, and someone was adamant that she had her cycle on the pill, and on the other side, someone was
Wow.
saying like, no, you can't have your cycle on the pill. So it's super interesting to know that you can, but it's dependent on I assume the person
Yeah,
really.
exactly. It really depends on the person, and especially if you're taking, for example, the pill every day, you're kind of getting that like instant kind of spike of hormone, like
Mm,
of the estrogen progesterone that you're taking. So you are kind of getting like that kind of pulsating kind of your hormones as you go along. And I think it just depends on your body and how it responds to that higher level of hormones and whether it finds kind of a rhythm or balance with that.